going through that with you, we didn't, just because I was breaking into the dental implant specialty field for the business development and marketing side of things, and really the client that we're talking about here that did my, fix some dental implants that failed from Costa Rica. I mean, he was, and remember, that's how you found him. You actually helped me find someone local. That's how we actually,
I tried to get you to go to him before Costa Rica, as I recall.
Yeah. But going back to, just because he was the client, you're my mom, which is way more important than him being my client. And so I took the knowledge that I had already gained at that point, and we went to multiple consultations, and that's one of the things that I always want to encourage patients to do. I'm not a fan of radiation. I hate just how they'll try to, everybody wants their own CT scan and all that kind of good stuff, which is a pain. But, to try to get your images, which we were able to because we had a relationship. I always want to tell patients, try to get your disc of images for the first one. And then as you go to the other ones, ask, so you don't have to go through the CT scan and all that kind of good stuff over and over for the extended radiation. But we went to 3 of the top ones you'll see on TV, the ones that I knew because I'm in the marketing game, that are doing the most business, doing the most of these, because you're going to think, okay, the guy who does the most has got the most practice. And so, going through this process, the heart behind doing this is really for the son doing it for his mom out there, for the mom doing it for his son. It is so hard to know who to trust. You just go to the ones that do the most business, and look at what happened when we went to all 3 of those. All 3 were different stories, right?
Right. And there was never any question. What I happened to go, the first one I went to was the doctor the dentist you were going to. And he was right up front and very honest that if you were my mother, I wouldn't do this. You just have too much
for the upper
bone,
part.
For the upper.
Yeah, lower is fine, but
you just have too much bone loss, because I've been wearing an upper denture all those years. And anybody that's thinking about a denture, let me tell you, you check this out first before you go the denture route. This is from one that wore one for a long time, and I've been on both sides of the fence. So I know from whence I'm cometh. He told me right up front. Well, the other 3 that I went to, there wasn't any question.
They could do it right.
That they could do it, just, let's make you an appointment or click, click. Never even mentioned the bone loss. Did not even mention it.
And one of them said, do it right away, do surgery, and you walk out with your final teeth. Remember that?
That day.
Your finals.
Day. And I'll see you in a year to clean them.
And we really went through several hours of consultations to find this, and all 3 were different.
All 3 were different, but not one of them mentioned the bone loss, which makes it, really is a red flag to me, because of all that I had to go through in order to get this, done right. That I can, what if I had not gone to this other one, the one that I ended up with, the great man that I ended up with. If I had not gone to him first, and I had gone to one of the others, and they said, no problem, let's just... Now that's the whole reason to go to a number of different people before you make the final decision.
Right.
Because if you go in one of them, it was just a lovely office. The people were lovely that were there. I really liked them.
Yeah, they were
I
very
really-
likable, weren't they?
I really liked the people and the sincerity. But again, the bone loss wasn't even mentioned.
No.